Gracias. Buenos días.
Buenos días.
¿Cómo están? ¿Bien?
Bien.
¿Ya hablan español? Un poquito, sí. Bien. I speak a little bit English. I'm kind of rusty. I used to live in the States for a while, but it's been a while already. So I'm going to do my best for you to understand what I'm trying to communicate today. First of all, thank you very much for having us here today. It's a beautiful place. We've been in Ajijic several times, but never at this location. So this location is beautiful, probably the most beautiful place that I ever have a conference or speak with people. This is very nice. So I want to thank the Chapala Lake Society for the invitation today. For us, it is very important to be here today. My name is Jorge Martinez. I'm a physician. I work on social medicine and global health for the last 20 years probably. Not only in Mexico, but also overseas. I used to work in Peru for 3 years, in Ecuador for another couple of years, and I used to be as well in Europe working projects in sub-Saharan Africa. But the last years I spent it here in my hometown, Guadalajara. And I always wanted to work for the communities nearby. I spent a lot of time overseas, but never near my hometown. Do you mind if I walk around? No. I prefer. So, approximately 3 years ago, a friend of mine contacted me in order to have a better understanding of a problem that they have been trying to solve in the area near the lake. Raise your hand if you hear about a town called Mezcala. Oh, all of you. Have you been there?
Yes.
Nice, great. Mezcala is not far from here. It's actually probably half an hour if you drive there. There is a little town before you get to Mezcala. Sometimes it's hard to find because there is not like a proper sign on the road. But the name is Ojo de Agua. Raise your hand if you have been in Ojo de Agua. Nice! 1, 2, 3 people. Nice. Ellas viven en Ojo de Agua. Levanten su mano, chicas. I want to start introducing here our community health workers who are the most important people of this project. Unfortunately, they don't speak English, so I'm going to do some translation for them. Okay? Ojo de Agua is a very, very small community. And my friend, Arturo, is an environmental engineer. So they were running a diagnosis to see how the global warming is going to impact this small community. And they realized that the impact is going to be severe there, especially on the agriculture. This community grow chayotes. Have you ever tried chayotes?
Yeah.
Very nice chayotes, right? So they gonna be impacted by that. And most of the people that live in this community are fishermen or they working in the agriculture. So be working outside in the heat is dangerous. So with the global warming, it's gonna be way more dangerous, okay? So my friend invited me to talk a little bit about diseases related with global warming, which are especially heat stroke, dehydration, and diseases transmitted by vectors like mosquitoes, right? Dengue, chikungunya, Zika, okay? So we've been talking about that with the community for a while. Then I'm gonna step back a few years before this. I used to work for an American non-profit called Partners in Health. Have you heard about this organization?
No.
Partners in Health was founded by Paul Farmer. There is a documentary on Netflix about Paul Farmer. They're based in Boston, but they have several projects overseas. There is one very important, especially in Haiti and in Africa and Sub-Saharan. So I used to work for them during the pandemic times, right? I used to work in Chiapas. Raise your hand if you've been in Chiapas. Beautiful state. One of the most beautiful probably in Mexico. Very rich in nature and in culture, but one of the poorest countries as well, states in Mexico. So one of the main problems in this state is the lack of medical services. If you go up in the mountains in Chiapas, it's very hard to find medical service, a little clinic. You know, it's very, very, very hard to find. And if you find one, there is a big possibility that you didn't find any physicians there or doctors. They are empty, okay? Because they are very isolated. In Mexico, we have a very huge problem with the public health because most of our physicians want to remain or stay in the big cities. No one wants to go to the countryside. And the countryside is the one that have the most or the bigger needs, okay? So in Partners in Health, we implement a project for these communities who lack of medical services. So what we don't have doctors, we don't have nurses, but we have people that is encouraged and are enthusiastic to help their community. So we work a project that is focused on non-professional medical providers, okay? Which is basically the community. This project is not new. We implemented already in Malawi in Africa. That's actually the place when the project was born. Places when you have to drive 100 miles to find medical services, okay? So what we have is the community, yeah? And most of the diseases, or the most important ones, are the chronic ones. Do you know that people die because of diabetes? It's the first cause of death worldwide. And it's the first cause of death in Mexico. Hypertension, cardiac diseases. Those kind of diseases that can be prevented. Prevented in different ways, with medication, of course, but also with lifestyle, changing the lifestyle. I'm pretty sure you understand about this. So when we visit Ojo de Agua for the first time, we talk about climate change and the diseases related with climate change, but then I talk about the project in Chiapas. And I talk about these women who are trained to be medical providers, non-professional medical providers who work for the community in order to be like the first attendants of the community. They visit the houses, they travel with a bag, with devices to measure the blood pressure, and also to measure the sugar, things that you use at home, right? Daily you take your sugar, you see how you go, you measure your pressure. But people in poor communities, they don't have access to that. And they don't have access to physicians. They have to go to Mezcala in order to see a doctor. Now it's a little bit easier to go from Ojo de Agua to Mezcala because there are buses to go there. But a few years ago, people have to walk, and walk an hour. Probably for a young people is something easy, but not for elderly people or people who have disabilities somehow, right? So what can we do in Ojo de Agua to improve the health of the community? So we have to work with the local people. So when I talk about this project in Chiapas, women, the first thing they told me was, we want that here. We want that here. Because we are worried about our community. We have several people who are suffering from chronic diseases, and no one takes care about them. And when the chronic disease get out of control, it's very possible that people can get in a very dangerous zone. When they are under control, people can live a long life, taking medication, eating better. But if they don't know how they are, if they don't know the status of their disease, it's something that can get very, very difficult. Am I clear here? Yes? Thank you. Thank you. So, we say, okay, we need resources to do this in order to train people. So 3 years ago, Doctora Mariana Orellana, which is here, she's a nutriologist, decided to join the project because, I mean, me as a physician, I know I have good understanding of chronic diseases, but if we want to work in terms of lifestyle medicine, we need someone who have a different approach. So she joined the project, and we start this training. We already had the methodology because we've been implementing this methodology in Chiapas. And especially we have a group of women very enthusiastic about this. So not only from Ojo de Agua, but also from Mezcala, we opened the program for the woman to join, and approximately between 30 and 35 women joined the project for the training. So we were impressed about that because people were very enthusiastic, especially the women. And at the end of the project, we decided to hire 5 of them. So we trained 30 of them for almost 3 months approximately. We trained them on chronic diseases. We trained them also in vector transmitted diseases, diseases by mosquitoes, heat stroke, dehydration, and am I missing something else?
Undernutrition.
Malnutrition, yes, malnutrition as well, because malnutrition is directly affected the community. Obesity as well, and lipids, hyperlipidemics. So, at the end of this training, we decided to hire 5 of them as the community health workers of the community in Ojo de Agua. Here we have 3 of them with us. The other 2 couldn't come today because they have other things to do. But since that day, the community somehow changed. And I'm not going to talk about this. I'm going to ask them to talk about that a little later in the conversation. So for the first time, Ojo de Agua had local women who be trained to visit the houses and see people and visit people and talk about their diseases and measure the pressure and the blood and take the weight and see if there are like malnutrition situations on the houses for the first time. So we worked with them for a period of 6 months, 1 year almost, when they were visiting the houses. There are around 60 houses in Ojo de Agua. So there are like 5 community health workers. Each of them have 10 houses each. So they have to visit those houses at least every month, cover all the houses. And we provide them with sheets to documentate what they find there. And we also provide them with all the information to see if there is people who are out of control on chronic diseases like diabetes or hypertension. They communicate to us and we can refer those patients to Mezcala, right? In order for them to be or have the proper medical care. After that year, we run out of money to keep covering their payment because they receive a monthly payment. They are not working for free. But the project was only designed as a pilot for 1 year. And then after 1 year, we stopped working there. And then a few months after that year, we came back to Ojo de Agua to see how the things were. And we realized that they were keeping working and visiting the houses, even if the project was running out of time. So we get very impressed about that because we found that people in the community already see them as a reference as a medical providers. So they still visit in the houses. Then with the whole information that we recover from there, we realized that we get a lot of findings actually. We saw that there were a lot of people with chronic diseases that they didn't knew that they have chronic diseases. So after their visit, they visit the health center and then get the diagnosis and then the treatment. Then they found people who know that they have chronic diseases, but they were totally under control. Okay? So we took them to the clinic and then get in control. And also they find people who were suffering for overweight. We realized, for example, because we have a questionnaire of social demographic questions. How much exercise you do daily? What is the quality of the food you have access to? So we get a lot of information and we realize that these lifestyle things that we were thinking about were not necessarily the best in this community. There was a lack of access to food and a lack of practice of exercise in the community. So there were a lot of things that we saw that we can somehow try to solve in the second stage of the project. So right now, we are in the second stage of the project. We get more resources to continue with the implementation, and we are trying to focus this on the lifestyle medicine. And in here, we want to break a paradigm, because sometimes lifestyle medicine is something that people related more with middle class or upper class society, people who can have access to a gym or to a good quality alimentation. But we want to break that paradigm, because we think that lifestyle medicine should be something for everybody, right? So 3 months ago, we start to work with the project again. So we are working again with the community health workers. They already receiving a new payment to visit the houses again, and not only do this monitoring of the health, but also bring a message to the people and bring information about how can you improve your health beside the medical treatments. Lifestyle. So we're talking about exercise, we're talking about good alimentation, we're talking about better sleep, we're talking about better relationships, and the psychological side. So we start to make some workshops with the people in order to explain all this with the community health workers as well. And we start to make some activations in the community. Today, we're gonna take a walk for half an hour, something that people do not do normally as an exercise. Sometimes they do it for work, but not as something that is more like entertainment or relaxing or exercise. People were interested as well in things like meditation or yoga, or how to cook better, to have better recipes to cook. So we are working with them on that side too. And of course, we're measuring everything. They are visiting the houses again, so we have information, how is the lifestyle of people, then we do the intervention, and then we're gonna measure again how people change their habits. That's what we're trying to do right now. So in this second stage of the project, the community health workers will still be very important, but we all are also involving the community. Problems that we are facing now, Ojo de Agua do not have any space for exercise. Kids are playing football, soccer football, in the plaza, which is very small. And they already have a piece of land that the municipio donate for them, but no one have helping them to build a soccer field. And we ask the community, and that's one of the most important needs that they have. If they want to play football, for example, young people or adolescents or even adults, they have to go to Mezcala or they have to come here to Ajijic. They don't have a place when they are. Second need that they have is a medical dispensary. Am I right saying this? They have to go to drugstores, they have to travel to here or to Jocotepec or to Chapala. There is no way, if people have an emergency there, for example, hypertension emergency or diabetes emergency, there's no place in the town when they can have access to medication. So that's another important need that they have. And the other one is, now that we are introduced them to different ways to do exercise, of course we need some kind of equipment for that, like yoga mats or things that they can do weight. There are elderly people in the community who can easily exercise at home if they have at least like the basic resources for that. So right now in this second stage of the project, these are our most important needs. We also are looking forward to see people who can get involved. Sometimes people have knowledge or skills in different things and they want to volunteer with time. Probably people who want to teach cooking, for example, or exercise, or yoga, or meditation. So I want to mention this, that we are open to people who want to join the project. We're visiting the community from Guadalajara weekly. We are going to the community for these trainings and for these presentations. I don't know what I'm missing now. Presentarles. So now I want you to introduce you with with the starts of this project. We are very happy that they take some time to come here today. They were very excited as well to come here. So, ¿quieren pasar aquí al frente un poquito, por favor, chicas? Si se les podemos, we can give them an applause, please. Something that I didn't mention before is that these women do this work or enroll in this project totally volunteering, and then we hire them. We provide them with a pantry, is the name? When you give like a despensa, like a monthly box of food for there and for their family. It's around more than 1,000 pesos pantry monthly for the work that they are doing. All of them are housewives, all of them have kids. Some have young kids and some other have old kids. One of them, for example, have a little restaurant in Ojo de Agua, so if you visit there, it's right by the lake and you can have a great ceviche and a cerveza there. And some other are housewives that are worried about their community. So I want to introduce Leti. ¿Puedes decir tu nombre completo, Leti?
Sí.
They're calling from the restaurant because there is always people.
Sí, buenos días.
Buenos días, Leti.
Me llamo Leti y soy agente de salud de Ojo de Agua.
We can't hear you.
Que más fuerte. Bueno.
Sí, buenos días. Me llamo Leti y soy agente de salud de Ojo de Agua. Nosotros llegó el proyecto con los doctores y nos capacitaron para checar la presión, el azúcar, ahí al rancho Ojo de Agua. Y pues estamos en la lucha, checamos la presión, la glucosa, pues ahí estamos estudiando. Pues,
primero a traducir.
Sí, yo lo voy a traducir, tú lo dijiste, yo lo voy a traducir ahora.
Sí, está bien.
So let's say that they have been trained in order to visit the houses and make this checkup for the patients, especially in chronic diseases. And when they say that they study, it's because they really study. Mariana, Dr. Mariana here, she's a professor, a full-time professor at Tec de Monterrey in Guadalajara, in the nutrition college. So when we prepared all the theory for them, it was not an easy thing. It was very, very complicated to take something complex as the chronic diseases and take it to the level of people in the community. But they have to have an understanding how the body works in terms of physiology and anatomy. So they spend a lot of time in the classroom actually studying, and they actually take a test as well, an exam, in order to measure the knowledge. So at the end we choose the people who were more encouraged, but also who has the ability to have a better understanding and the ability to work with people. So what Leti was saying is that they study a lot and they've been trained for chronic diseases. Ahora yo quiero preguntarle a Betty, ¿cómo esto sientes que te ha cambiado a ti de manera personal desde que te volviste una trabajadora comunitaria de la salud? Voy a traducirlo rápido. I'm asking her how this developing of capacities as a community health worker changed her life, her daily life in the community.
Mi nombre es Betty. Pues para mí es un honor pertenecer al grupo de agentes comunitarias. Me interesé por este proyecto porque mi mamá, ella vive con diabetes y en mi comunidad pues no hay un servicio de salud donde ellos se puedan atender. recurrimos a Mezcala. Y cuando nos hablaron del proyecto, pues decidí integrarme para poder apoyar no solamente a mi mamá, sino a la comunidad. Me ha ayudado mucho a crecer como persona, como ser humano, poder ayudar a las personas de mi comunidad a llevar un control, a personas que no sabían que vivían con enfermedad crónica como diabetes e hipertensión. Pues como persona me ha ayudado mucho y me siento satisfecha, me siento feliz de poder ayudar a mi comunidad.
Gracias, Betty. Betty, she's sharing with us today that the project definitely changed her life personally, but she approached to the project in the first moment because her mom lives with diabetes. So she wants to help her somehow, and she wants to help the community. And she feels proud to see that after their training and after their visiting the houses, they were able to detect people who were living with diabetes or hypertension, but they didn't know. Because some of the statistics that we found, a little later, Mariana is going to share with you a QR code so you can have access to our full presentation with all the statistics. So some of the most important findings that we recollect is that 40% of the population haven't have a medical visit in the last 6 months. So sometimes people spend a lot of time without going to the doctor. And especially in this community that have elderly people, that is something that could be not really good for their health because they just don't have information of how they are. So with this intervention, Betty is mentioning that they were able to detect new cases of people which are now under control, or people who knows that they have chronic diseases but they were under control. And for Betty, she also mentioned that this somehow empowered her in the community. Now the community see them in a different way somehow. Gracias, Betty. Muchas gracias. Y ahora me toca preguntarle a Flor. A Flor me gustaría mucho preguntarle, pues, ¿cómo sientes, Flor, que la comunidad ha recibido este proyecto, ¿no? A partir de que iniciaron su trabajo, ¿cómo los han recibido? ¿Y cómo sientes tú que la comunidad ahora está involucrada también, ahora que estamos haciendo actividades no solo con ustedes, sino que también hacemos actividades con el resto de la comunidad? I'm asking her how she feels that the community is receiving this project or appropriate this project, especially now that we are in this second stage when we are working not only with the community health workers but also with the whole community. That's my question. Yes. Y si te quieres presentar primero.
Muy buenos días, yo me llamo Flor, muchas gracias por la invitación a esta congregación que hicieron. Pues en la comunidad, ahora que ya hay nosotros como agentes comunitarias, ya les checamos la glucosa, la presión, como dijeron mis compañeras, ya están en un control más mejor, ya están controlando sus enfermedades crónicas y con las clases que han tenido de comida, de ejercicios, se están activando más a hacer ejercicio, a comer saludable, a cuidarse para estar mejor en su salud, ahorita con los doctores que nos están dando estas capacitaciones a todo el pueblo en general. Entonces sí, ahora ya vamos a seguir más adelante con nuestra salud más que nada del pueblo, por los niños también, para que ya no sigan la misma rutina de la comida, de que se están enfermando de lo mismo de la glucosa y eso, de hipertensión. Entonces desde los niños estamos empezando a que ellos también se enseñen a comer saludable para que en un grado tiempo no se enfermen y sean unos niños mejores que los que ahorita tenemos.
Gracias. Flor is saying thank you for the invitation, first of all, and she also is mentioning that the community somehow start to change their habits, little by little, but they start to change their habits. We have to mention that we make a partnership with the food bank in Guadalajara, so they are also now providing this community with a pantry of quality food monthly. Sometimes the food that they provide is not the food that they are used to get in the local market. So we are developing some recipes and some trainings of how to cook these new pantries that they're getting. But they also, Floris also mentioned that people start to be more motivated to do exercise or cook in a different way, more healthy. We actually have a WhatsApp chat when people share their dishes. So if they cook something today, they share it with the community and actually share the recipe. So now they know how to cook things that they are receiving from the food bank. Floris also mentioned that we are working also with the young children. Actually, the nutritionists visit the primary school and they make a checkup of every kid in the primary school to see if they were like obesity or malnutrition. So they are also involved in the project. Unfortunately, sometimes the young kids are the ones who have access to a lot of ultra-processed food and not really good food. So that is something that we want to change for the new generations. So the message is not only for adults, but also for kids who are getting involved as well in the project. I think I have 5 minutes left, and I don't want to miss the chance for you to ask any question about this project. We normally do this presentation with a PPT. We are sorry about that because there's no way to project here, but we are sharing the QR codes so you can check up the project, and if you want to get involved, our emails from Dr. Mariana and I are there, so you can get in contact with us. So now I want to open the mics for you, but first give another applause for this woman.
Just a reminder, this is the time for questions and not for stories or sharing. So if you've got a story or sharing, please sign up to give your own talk. So who has some questions?
Okay, that was a great presentation, but I wonder if you know the new federal government program. The old senior citizens like myself have been surveyed that doctors and nurses are going to come to their houses to check blood pressure or whatever.
Yes.
And so it's going to be, I think, every other month or monthly. It's starting this month.
Yes.
Are you aware of that?
Yes, we are aware of that. Actually, for Dr. Mariana and I, we were talking about that because we start before this announcement from the government, and when they come up with that, we say, great, someone else, especially the government, is getting on board on the project. So I think we are not competing between us. So far, they haven't visited the communities yet. At least not this community. Hopefully they do it soon. But I think that what we start here was very innovative for the community somehow. And I think it's not gonna be once against the other. They're gonna only apport like new things for the community. So if they do that, if they really visit the communities, and not only the communities, but also the schools, because the compromise of the government is visit every single school and do what we did with the professional teams. So if they do that, I think the more the better for the community. So that's how we talk. And if we can work together, that would be awesome. It is important to mention that we shared this project in the beginning to the Ministry of Health in Jalisco, so they are aware that we are working there. Our goal is that the community health workers can be recognized by the government as a non-professional medical providers, as they do in other places in the world. So thank you very much for sharing that. It is very important, and hopefully they can visit Guadalajara as well, Ojo de Agua as well. Next question.
Thank you very much. I'd like to ask the women how they feel their identity has been affected by becoming health workers in the community, and also how the identity of the community, how it has been, if it has been impacted, although I know it's just beginning project.
Thank you very much for your question. Really good question. Les pregunta a ella que si de alguna manera su identidad, ¿no? O digamos como su día a día ha cambiado o se ha habido afectado a partir de que se hicieron trabajadoras comunitarias de la salud, o si sienten que la comunidad de alguna manera se ha visto impactada por eso.
There's a microphone over there.
No, they.
Al menos en mi caso no me afectó, solamente me organicé en mis horarios, yo soy mamá, me organicé en mis horarios para poder atender a mi hogar, a mis hijas, a mi esposo y a mi comunidad. Sí hay momentos en los que la comunidad requiere del servicio de toma de presión y glucosa. Cuando hay personas que se sienten mal, me llaman. Y pues a veces sí estoy en quehaceres, pero trato de hacer lo posible de correr rápido para apoyar a la persona que lo necesita. Pero pues, pues no nos afectó en nuestra rutina diaria, ¿no? Y pues al contrario, a mí me ayudó mucho porque pues a las 5 ya nos identifican como agentes de salud, y cuando no puede una, pues no, las otras acudimos al lugar donde nos necesiten.
Gracias, Betty. She's mentioned that they are busy women because they are mothers, they have kids, especially Betty have little kids. But it was just a matter to have a better organization and somehow her schedule changed, but she just organized it in a different way in order to keep time to visit the patient, but also to be with her family. And what she also said is that people in the town already see them as a reference. So it doesn't matter if it's a chronic disease. If someone gets sick, like a infection in the throat, for example, or fever, they contact them immediately. So sometimes they don't know probably how to solve the problem, but we have a very good communication. So they text me or Doctora Mariana, and we try to help. And the other thing that she mentioned is when one of them can visit a house who has a need, the other community health workers take her place. So they are working as a team as well. It's a very, very small community. And we're talking about 165 habitantes tienen más o menos ustedes, ¿no? Por ahí. Between 160, 180 people live in the community. And some of them are relatives. So the communication between them is very important. So even if they have designed houses for each of them, they help each other. I hope that I answered your question. Very good question, by the way. Thank you very much.
Okay. Thank you so much for the important work you do and for telling us all about it. I wanted to ask first, if you're getting the support you would like and need from the government of Jalisco or the federal government, do you see a potential for more support? Because you've created a model program. That's my first question. My second question is, does anyone teach domestic agriculture to teach people how to plant gardens, home gardens, to grow food that is healthy?
Thank you very much. Thank you very much for your question. First of all, and this is very important to mention, I didn't mention before, we are not funded by the government. We are funded by a non-profit. Especially, there is one which is called Protagonists, who works in climate change. So as you remember in the conversation, that was the first thing that I mentioned. In the first place, we were invited because of climate change related with diseases. So the name is Protagonists. That's a non-profit that works with the government. And there is another non-profit called Corporativa de Fundaciones, which is based in Guadalajara, which is the one that right now in this second stage of the project, they are donors. The government, we share the project with them, but they do not fund this project at all. We want them to get involved, but we need to find the way to involve them. The thing is that politically, we start the project in a very, very strange moment because there were the elections and the parties were changing. So sometimes it's easier and faster to go through the non-profit than to go to the government. But the support of the government, if we want this project to run a long term, is fundamental, definitely. And your second question was related with agriculture, right? Recently, in these workshops and in these interventions that we did, because Doctora Mariana is a professor at Tec de Monterrey, she have a partnership with Drake University from Des Moines, Iowa. Have you heard about this place? Is anyone from Des Moines here? No one from Des Moines? Are you? No.
Relatives from Des Moines.
Oh, okay, good.
My family.
So we have a partnership with them, and they made a little project of horticulture in the community. But we made it more focused on like a therapy work, stress management through horticulture. But if you have the knowledge, or you know someone who has the knowledge, or want to make a little workshop for them, we'll be more than happy. They grow chayote. That's the most important thing they grow. But they also are open to learn new things and do new things for the community. So one of the reasons we came here today is because we're looking for volunteers who live nearby and want to get involved in the project. Thank you very much for your question. Sir.
I'm wondering if you keep data, or if the our practitioners here actually collect data on the population, medical data, like medical records or patient data or this sort of thing, and if they keep track of progress and changes in the population. I mean, as a public health person, you're very well aware of that. I'm just wondering what the status is of informatics at the village level. Individuals in the village, and if they keep track of it themselves.
Thank you very much. Great question. Everybody can hear? He's asking if we are recollecting data about all the work that we're doing. And the answer is yes. Since the first stage of the project, we are recollecting data. In the beginning, we thought that we can do it as the way we do it in Chiapas, when we have more resources. So if there, women have an application in the mobile, we provide them with a mobile phone, with an application, when they can recollect all the data there. But it was very expensive for us. And also, they have a lack of internet access in the community. So we decided to do all in paper. It's more work, but it is very important to recollect the data. So every single house they visit since the first time, they have a bunch of sheets that they are recollecting. Names, social demographic information, all the measures related with high blood pressure, diabetes, everything is in there. And then we took all that information, and with the help of the students from nutrition and medicine in Guadalajara, we extract all that information and we put it on digital. So we have all that information, all that data that we process, and we present during the first stage of the project, we present a diagnosis, health diagnosis of the community made by these women. So these women took the information, we process them, and we make the informed. So if you're interested to see the data, of course we can share it with you. And in this second stage of the project, we also recollating data to see how the information, the workshops, the activations that we do, how is changing the habits of the people. So the idea is actually to publish papers because of the link that we have with the university. So that's the idea. And this, as I mentioned before, this is very innovative because lifestyle medicine, I don't know anyone who do this in the rural area. They always do it in the cities. Right. So for us, this is something new that can hopefully help us to take resources from people who can support this kind of interventions. Thank you very much for your question.
What university and what departments from that university?
Tecnológico de Monterrey and Universidad Guadalajara, both are involved in the project. Universidad Guadalajara is the nutrition college, and in Tec de Monterrey is medicine and nutrition as well. We working, I didn't mention this, but we working with social service providers. So every practitioner in Mexico have to do 1 year of social service in a rural community. So we have a bunch of nutrition students from the last grades already about to graduate, and we also have physicians as well. So there are people who are getting involved. There is a psychology who was involved as well, and as I mentioned before, also Drake University have been involved in the project.
Great.
Thank you very much for your question.
Quick question, I think for Betty.
Para Betty.
Betty?
Sí.
How was your mother with the diabetes? Was she helped?
How is she?
Yeah, it was her mother. Her mother had the diabetes. How is her mother helped?
¿Cómo está tu mamá ahora de su diabetes? ¿Quieres ser mi... Aquí está.
Pues mi mamá ya se encuentra controlada porque sí manejaba los niveles de glucosa un poquito altos y era de que seguido le mandaban a hacer estudios de sangre, pero ahorita con esto era debido a la mala alimentación que se llevaba. No tanto en que no comía bien, sino que a veces los doctores prohíben mucho el refresco en las comidas, y pues mi mamá era de que poquito refresco, poquito solamente. Entonces ahora con estos temas de nutrición y todos los talleres que nos están dando, pues entonces mi mamá ya no consume, sí consume refresco, pero no igual que antes, entonces ella ya maneja sus niveles de glucosa normales.
Gracias, Betty. Gracias. She's mentioned that somehow her mom is under control now because have a daughter who can check and watch after her. Of course, that's very important. But also she have a better understanding of how bad habits can impact on your health. So, Ojo de Agua, when we recollect information, we saw that they are really, really big Coca-Cola drinkers. Even the kids.
Oh, especially.
Yeah, and that's the problem, because if they go to the groceries, which is probably 2 groceries in the small town, that's what they have access to, right? It's very difficult to attack that, because at the end is how people make money as well in the community. But if we offer them different things, if we teach them how to cook better at home and offer the kids different kind of things, we can make these changes. So Betty's mentioned that her mom haven't stopped drinking soda, but she's drinking less. And at least now she's under control and be watching after her. There is some big problem that we still have, and is the lack of access to medication. Someone were mentioning before the government. The government have a huge issue of lack of medication in the public health services. So every time we go to Ojo de Agua, there is some patient who do not have insulin. Insulin is not cheap, it's not easy to storage, and it's really hard to have access in that community. They have to travel here. Sometimes people need medical studies, which are not cheap as well. So those are the other kind of needs that we have. And as far as we don't get a partnership with the government, we have to get the resources from private sources or non-profits. But it's something that is affecting us, because even when they go visit the houses monthly or weekly and check up the patients, if they don't have the medication, it's going to be hard to get people under control. So that's another big need that we have. So if there are no more questions, otra pregunta por allá. Muy bien.
Hi, thank you very much for providing such a valuable service to the community. You mentioned medication. So right now, in either phase 1 or phase 2, there's no medication involved. It's only monitoring.
That's right. That's right. We do not provide. I mean, they do not provide medications because it's not her role.
Okay.
They are only community health workers that can make checkups at houses and then communicate with us. But if they need a recipe, I have to do the recipe, or they have to go to the nearest medical service, which is in Mezcala. Prescription, sorry. Recipe, yes, recipe. Sorry.
That's okay.
I was still thinking about food.
And, if you may, do you have like an average cost of what the phase 1 and what the phase 2 would be for this community of 60?
In terms of medications,
In terms of what you're doing?
in terms of what we're doing, approximately cost, I mean, we don't have exactly the number, but we do know what we need. For example, right now we need to have kitchen accessories like pans and ollas for the workshops, which are something that is happening right now in the next few weeks. And we also need things to provide to the community to do exercise, like weights or yoga pads, things like that. We don't have exactly the number, but we can come up with a number if you are interested, or if this community are interested to donor, we can come up with a number in the next few days. In terms of equipment and also medication, which I think will be something very helpful. Thank you very much for your question.
This will be our final question, but you can go up afterwards and ask them any
Yeah, of
further
course,
questions.
we're gonna be here.
Again, thank you for the wonderful presentation. How many phases is the program? You mentioned that you're in phase 2, and how long will it take to get the community enrolled?
Very important.
That's number one. Number two, and finally, is what are the roles that you're looking to fulfill as volunteers?
Thank you. Yeah, this is the second stage of the project. In the beginning, we never thought that we will get this far because it was only a pilot in the beginning. But then, when we returned after a few months without going to Ojo de Agua, and we saw that these women keep information on regular books. I mean, they have libretas, and they keep record of every single patient without getting any payment and without our visiting. We realized that this is not our project anymore. This is their project. Because even when we weren't there, they keep working and visiting the houses. And they actually run out of the strips for the glucometer. And they bought it themselves. So then we realized about this. So now our presence is important, but the project keep running because they are already a reference there. The second stage is going to run for the rest of the year until October probably, and then we don't going to have resources anymore again. But our donors are very enthusiastic that probably there is a possibility that we want to continue with the project. And they also have proposed us to work in other communities with similar characteristics than this community. And in that case, our proposal is that we don't want to be the trainers anymore. We want them to train their peers. You know what I mean? And that will be a great step for them. Of course, they have to get a payment for that, a different kind of payment, not only as community health workers, but also as a trainers. So we don't have anything clear yet, but the donors are enthusiastic because they work in the area. They work in different communities by the lake area. So they're very enthusiastic to scale up this project to different communities and make some replicas. But so far we don't have anything clear. Yes, it's a work in progress. We are now focused only in Ojo de Agua. Thanks for your question.
We had one other question. You're looking for volunteers.
Oh, yes, sorry. We're looking for volunteers. I mean, any kind of time that you can provide to the project is valuable for us, but we're looking for people who like to cook healthy, who like to do exercise. And I'm not talking about hard exercise. I'm talking about regular walking, hiking, functional exercise, dancing, yoga, those kind of things. I mean, if you people do that regularly and you want to share probably 1 hour, 2 hours of your time, go to the community with us, of course, and do an activity, horticulture, ¿qué más?
Sí, gardening.
Gardening, anything, we are opening for that. Meditation as well. Those are the things that the community let us know that they were interested to do. If there's people here who like football or sports as well and work with the kids, that would be awesome too.
Okay, big applause.